This is Melanie Matthews from the Healthcare Intelligence Network, bringing you this month's Healthcare Performance Benchmarks. Today, we examined 2011 benchmarks for accountable care organizations. Our February 2011 ACO survey found that 14% of healthcare companies are reframing their care delivery structures as an ACO. Of the remaining respondents, 38% will begin work on an ACO in the next 12 months. Built into the ACO model is a business opportunity, provide a focal point of care while attaining health and cost containment goals. But the 400-page ACO rule issued in March by CMS raised many questions on the ACO application process.
You're going to have to go through a significant amount of startup work and cost just to put in an application. And once you're accepted, then you find out the data relative to the patient population, which is driven by the physicians within ACO. So you're going to have to go down the path to become one before you really understand the potential magnitude of savings in that population. So a lot of risk, a lot of downside, not a tremendous amount of upside at that point, the way it's currently written.
Conducted before CMS issued its ACO rule, the survey also found that while hospitals administer the majority of today's ACOs, physicians will take the reins of ACOs in the future. An attorney advising the Queens County Medical Society on its ACO development says doctors preparing for this managerial role should be aware of the legal and regulatory hurdles in the ACO model.
There are a host of regulatory considerations that impact the formation and operation of ACOs, and they range on the federal side from antitrust considerations to fraud and abuse and anti-kickback considerations to STARK considerations, and a variety of other related concerns from a regulatory compliance perspective. On the state level, there are also a variety of state-based laws and regulations which impact the operation of these types of organizations. Those who are considering ACO formation would really do well to carefully consider how these laws and regulations impact the formation and the operation of an ACO.
Our survey also found that 2/3 of ACOs plan to participate in the CMS Shared Savings Program. Half of current ACOs expect 100 to 500 physicians to participate, and 1/3 of operating ACOs include a pharmacist. The greatest barrier to ACO activity is a lack of awareness about the model, say respondents with no plans to participate, followed by cost restrictions, reimbursement hurdles, and a lack of clarity from CMS on the ACO model. This is Melanie Matthews for the Healthcare Intelligence Network. For more survey results or a list of resources on this topic, please call the Healthcare Intelligence Network toll-free at 888-446-3530 or visit us at store.hin.com.